Hello friends, welcome to our show. A lot of women are facing various health problems these days. One of them is adenomyosis, which is a very common problem in women's healthcare. Let me introduce Dr. Pradeep Mule, Senior Consultant Interventional Radiologist practicing in New Delhi, India. Welcome to our show, Dr. Mule. Okay, now we can see that few women are really very healthy. They look really very healthy. Their lifestyle is very good. They go for regular exercise and they work like absolutely fine women. They have great stamina, but they are diagnosed with such diseases like adenomyosis. So what are the basic causes for this disease?
Although till now is not a known diagnosis. No other cause is there for adenomyosis. But a lot of doctors, they assume that why the adenomyosis develop. Because of the cesarean section, one cause, the cesarean section. During the cesarean section, when you cut the internal cavity to take out the baby at the time of the delivery, so that time the internal lining may not go exactly like the natural one.
Alright.
So that time some breaks are there into the lining of the uterus. So this lining sometimes breaks in the cells that migrate into the muscular wall.
They start growing inside the wall.
Growing. So like another cause is the when you know that after the delivery, the postpartum period is there. The recovery time is 1 month, 2 months, 3 months. That time sometimes the women, they don't know that the internal lining having some kind of the inflammation. Some kind of infection. So because of these infection, the lining structure that breaks and these lining cells that go into the muscular wall.
Okay.
So these are the two common causes are there: postpartum inflammation, or maybe sometimes the cesarean section also.
Then how does the lifestyle has its impact on a woman's capability of developing adenomyosis inside its uterus?
See the lifestyle, when you talk how this impact on your lifestyle. When a woman having the intense pain, that is the horrible things during the menses and before the menses.
Yes.
So 5 days plus another the 7 days, that goes around in a month, painful time around 10 to 15 days.
Yes.
Right, so you cannot do the normal day-to-day activity also. If you're a working woman, then also is more difficult to work also, to concentrate in your work. Right, so these overall this impact in your lifestyle. Even some guest or something is coming in your home, right? So you always feel, oh no, I'm so much in pain. How can I handle all the situation? On if a person having a longer time, this one, right? 1 year, 2 year, 3 year, 4 year, right? Some women, they really survive on this simple tablets, pain medication tablets and everything. But I've seen that around 20% of the women, they need the injectable medication to control their pain.
They've got so intense pain.
Yeah, so intense pain. So if this goes every month, they may sometimes develop some depression also, some anxiety also come. They always feel the little helplessness.
Okay.
Like 10% of the women, they have the painful husband and wife relationship.
Exactly.
Also. So they try to avoid that also because they know that once they've gone through this one, so they may get the pain during the intercourse and after the intercourse for period that 1 or 2, 3 days, right? That's all the painful. So these also is the kind of the frustrating. When you see the overall, the adenomyosis is the really for a treatment also, for a person also, those suffering by this is really frustrating.
Yes, because it is extremely painful and one cannot tolerate any...
Even the painful also, and some women, like 80% of the women, they have the heavy bleeding on the clots also.
Yeah.
So the blood hemoglobin that goes down every month, whatever you take the nutrition and other things, and next month you'll drain out.
Dr. Mule, I must appreciate what you are doing for such people who are not really very ready to undergo the surgical treatment, and really thanks for sharing this much information, this much important information for the people suffering from such kind of problems. Thank you.
Yeah, thank you very much.